Hello dear students, how are you all? I hope you are doing well, okay? And you are doing well in preparation as well. So last class we will discuss about the psychiatric terminologies part 1. Now we will discuss psychiatric nursing terminology part 2, okay? So all of you listen carefully and watch the video from beginning to end, okay? So this session is going to be very much helpful for you, okay? So let's begin today's session with the terminologies. First one is bulimia nervosa. Bulimia nervosa is a eating disorders characterized by excessive or binge eating followed by inappropriate method of compensating it. Okay, here the patient will eat excessively or heavily and followed by he will have a thought of weight gain and he uses inappropriate method to prevent the weight gain. Inappropriate method means he will induce vomiting for himself. Okay, he uses laxatives or diuretics or patient may engage in a excessive exercise. So that is nothing but a bulimia nervosa. Next one is cataplexy. Cataplexy is nothing but it is a temporary loss of muscle tone or a muscle weakness that happens when person exposed to the intense emotion. Whenever person exposed to the intense emotion, there is a chance of muscle tone, loss of muscle tone and a muscle weakness. So that happens. No, that happens when a person is precipitated with a intense emotion. That is known as a cataplexy. Next one is circumstantiality. Circumstantiality is nothing but the patient uses all unnecessary details in his answer when a question is asked to him and finally he will come to the answer. Okay, for example, if any question is asked to the patients, he will include all unnecessary details in his answer and finally he will come to the answer. Okay, so that is nothing but a circumstantiality. And next one is clang association. Clang association is nothing but a patient, here the patient uses two words which sounds similar, okay, but does not have any meaning. Okay, so that he uses two words which is of his choice. Okay, for example, patient uses let's go bazaar and bring achar. Okay, so this kind of two similar sounding words the patient keep on using. This is known as clang association. Next one is confabulation. Confabulation is nothing but it is the memory gap is filled with the inappropriate experiences. Okay, so when the memory gap is filled with the inappropriate experiences, it is known as a confabulation. This is usually associated with the organic pathology. Okay, when the patient is have a amnesia, whether retrograde amnesia or entrograde amnesia, the memory gap that is filled with the inappropriate experiences, okay, or imaginations, that is known as a confabulation. Next one is a conscious. Conscious is a state of alertness or it is a terminology in which patient is aware of self and his surrounding environment. That is nothing but a conscious. Next one is a conversion. Conversion is a nothing but it is a process in which the psychological stress, conflicts or conflict stress are turned to physical symptoms. Okay, for example, a person who is going to write examinations tomorrow, so he may have a nausea, vomiting or a headache. Okay, migraine headache. That is because of the psychological stress or tension or the conflict that turns to physical symptoms. That is nothing but a conversion. Next one is craving. Craving is nothing but it is a intense desire to use a substance or alcohol or any narcotic drugs. Okay, when a person is having a strong desire to take drugs, medications or alcohol, so that is known as a craving. For example, a person who is continuously taking the alcohol or drugs or substances, when you put him in one room and lock him, he will start shouting and he will have intense desire of taking medications or drugs or alcohol. So that is nothing but a craving. Next continue with the deja vu. So deja vu is nothing but the person who has visited any place for the first times, he feel like he has already experienced that place for the several times. For example, a person who has visited the Ooty for the first times, he feel like he has been visited Ooty several times in his past life. So that is nothing but a deja vu. Okay, next one is a delirium. Delirium is a mental state of confusion or excitement in which patient will have a disorientation to the time, place and person, hallucination and illusion and hallucination. This is delirium tremens. Delirium tremens is a condition that occurs when person who is taking alcohol continuously and heavily for several days, he suddenly stops taking alcohol. This delirium tremens occurs. It is characterized by tremor, that is involuntary movement of voluntary muscles, diaphoresis, okay, hallucinations and delirium. Okay. Next one is a delusion. So delusion is a false, fixed, unshakable belief. Okay, here the patient will have a false, fixed, unshakable belief. It means the beliefs are unshakable. We cannot change the belief. So that is nothing but a delusion. Delusion is a false, fixed, unshakable belief. Okay, so we have several types of delusions. Okay, so first is delusion of grandiosity. It is a false fixed belief in which patient believes that he is having a immense wealth, power, and hold an important position. Okay, patient feel that he is a very powerful person. Okay, patient feel that he is a prime minister of India and he has to go to Delhi to take oath. Okay, or patient feel that he is a supreme, he is having a supreme power and nothing is going to happen to him. So that is nothing but a delusion of grandiosity. Next one is a delusion of guilt. Delusion of guilt is nothing but it is a false fixed belief in which patient believes that he has done something sinful work for which he has to be punished. Okay, though he has not done any sinful work, but still he have unshakable belief that he has done something sinful work for which he has to be punished. Next one is delusion of persecution. Delusion of persecution is a false fixed belief in which patient believes that someone is trying to harm him or his family. Okay, so someone is trying to harm him or his family. That belief will be there. Okay. Next one is delusion of control. Delusion of control is a false fixed belief in which patient believes that his thoughts and his ideas is been controlled by some external agency. Some external agency is trying to control his thoughts or his movements. Everything is controlled by some external agency. Next is delusion of infidelity. It is a false fixed belief in which patient believes that his spouse is not faithful to him. Okay, she or he is having a illicit relationship with the others. Okay, illicit relationship is nothing but a sexual relationship with others. Okay, the intents of feeling belief will be so that the patient feel that his spouse may be having a illicit relationship with his own parents. Okay, his wife or husband having illicit relationship, sexual relationship with her or his own parents. Okay, that is nothing but a delusion of infidelity. Next is delusion of reference. It is a false fixed belief in which patient believes that the discussion is about him is going on everywhere. Okay, the whatever the program telecasted in the television or broadcast in the radio, everything discussion is happening about him only. Okay, that is nothing but a delusion of reference. Okay, next one is nihilistic delusion. It is a false fixed belief in which patient believes that the world is going to end. Okay, the entire world is going to end or finish it off. Okay, next one is somatic delusion. It is a false fixed belief. Okay, what is somatic delusion? It is a false fixed belief in which patient believes that some of his body parts are not properly working. Okay, his brain is rotting, his intestine is rotating. Okay, so this kind of thoughts will come to the patient. Okay, that is unshakable beliefs. Okay, next one is erotomania. Erotomania is a false fixed belief in which patient believes that someone is deeply loving him, and the person who is loving him is usually belongs to higher socioeconomic status. Okay, for example, the patient believes that Shah Rukh Khan is loving her or Aishwarya Rai is loving him. So like that, someone is deeply loving a person. The person believes that someone is deeply loving him or her, and the person who is deeply loving him or her usually belongs to higher socioeconomic status. Okay, so these are all the terminologies that we were planned to discuss today. So they have been discussed. Okay, so these are the very important terminology. All of you please note it down and please repeat it several times so that you will be familiar to the terminology. Okay, so if you like this video, please press the like button, and if you are the first time visitor to my channel, please subscribe and share to others as well. Okay, and please comment, okay, for any clarifications. So thank you very much. Okay, thank you all.